If you're in your 60s, please do not make this mistake. When it comes to planning for healthcare costs, too often people fail. They just ignore them. And let's face it, it's complicated and confusing. When you retire, whether it's before the age of 65 or after, there's a lot of different plans and jargon and language. It can be confusing. Let me share with you a story, and I'll change the name here, but Mike, we'll say, is 63. He wants to retire. Before the age of 65, he's kind of got two options. He can do private insurance or Cobra. Now, private insurance typically means most people start by looking at the Affordable Care Act. They'll go to their state's marketplace under Obamacare and shop for health insurance options. As you're aware, the amount of premium that you pay is directly dependent on your income, not your assets. Now, let's really break that down for a moment. You could have $10,000 to your name or 10 million to your name and be paying the same exact in monthly health insurance under Obamacare because it's based on income. So if those 10 million of assets are parked in a Roth IRA producing that much zero in income, but you're taking it out, you could still be paying the same amount in monthly premiums. Just keep that in the back of your mind. It works very similar for Medicare. It's income based, not asset based. Of course, when you turn 65, most retirees pop onto Medicare, and there's a lot to unpack there, whether we do a Medicare Advantage plan or a supplemental plan, as well as kind of keeping long term care planning in the back of their head to make sure that when the time comes, they are taken care of. So Mike was 63 when he retired. He retired early. He didn't have a health plan, and he was looking at Cobra, the health insurance that his employer would offer to him for a limited time after his retirement. But he realized, like many of you, that Cobra was very expensive, that the health insurance plan that he was getting from his employer was subsidized quite a bit, and it just did not make sense for him to cover the cost on his own. Unfortunately, this caused him to tap into his precious retirement accounts prematurely, earlier than he was expecting. Now, Mike was married. His wife Susan was 64. They had together $700,000 in a traditional IRA. They had $250,000, $250,000 in a taxable brokerage account, and $150,000 in cash savings. That included some CDs, money market accounts, cash and checking and savings. They had planned on retirement income coming from really two sources: their investments and Social Security. They didn't have any pension or anything like that. No rentals, no businesses, just kind of a plain vanilla situation. They'd worked, they'd saved, and they'd stayed out of debt. The goal was to enjoy a few years in their early retirement of traveling and freedom and seeing the kids and grandkids without having to worry too much about finances. So at 63, they were feeling confident that their nest egg and their investment portfolio was invested appropriately and would provide for them to live a few decades. Both their parents had kind of passed away in their late 70s, early 80s, and they weren't too concerned that they were going to outlive their money, but they did underestimate how expensive private insurance premiums would be before they came onto Medicare. They just didn't budget for the out-of-pocket expenses, deductibles, prescription drugs. And then at 65, when they did come onto Medicare, they were surprised by some of the gaps in Medicare coverage, and they underestimated the cost to supplement those costs with dental, vision, long-term care, all that being now part of the picture for them. The mistake that they made is they failed to include healthcare costs in their estimates for retirement planning. And what was happening is they were drawing down out of their retirement accounts at a much faster rate than they had originally planned on. Additionally, the market wasn't great in those first few years of retirement for them. And because they were taking out more than they expected, those dollars now didn't have the opportunity to recover as the market and economy went back up. They assumed Medicare would cover everything, but it didn't. They ended up getting a Medigap, or what we call supplemental insurance, and Medicare prescription drug plans. I mean, there was costs associated there. because they were taking out so much from their IRA, it actually pushed them into a higher tax bracket and, unfortunately, a higher IRMA bracket as well. IRMA is the income related monthly adjustment amount, which is the amount of premium you pay for Medicare coverage when you're on it. And by the way, it goes back 2 years. So when they filed for Medicare premiums at 65, it looked at their income when they were 63 and had taken a chunk out of their retirement to cover these costs. It's unfortunate. I mean, this story, it happens again and again to people as they think they have enough for retirement. They make that decision, and unfortunately for them, they weren't able to travel as much, and actually they had to do a little part-time job, something they weren't expecting to do, but they were just pulling so much money out to cover these healthcare related costs. Additionally, they were thinking about long-term care insurance, right? One of their parents needed a nursing home for a little bit longer, and they were looking at options there, but they quickly realized that for them, long-term care insurance policies were outrageously expensive. And their plan was to self-fund, to have the cash set aside to cover in-home care or assisted living or maybe even a nursing home if it got to that point. But the problem was their budget in retirement could not sustain their retirement living expenses. I don't want you to make this mistake. Before you retire, please consider healthcare costs as part of your plan. Get clear on what the Affordable Care Act premiums will be if you retire before the age of 65, because you don't want to be left holding the bag. And let me just be clear here. Medicare looks back 2 years at your income to determine your premiums this year. Affordable Care Act, on the other hand, it looks at current year's income. And they expect you to give them an estimate as to what your income will be for the year to determine the premiums that you will pay. By the way, Medicare has 2 adjustments for IRMA. Medicare Part B, doctor coverage, that's the bigger one, where your premiums can go up a few $100. But Medicare Part D, that's prescription drug. It goes up, but not nearly as much as Medicare Part B. And please set aside some money for annual out-of-pocket costs or any coverage that's not covered by just a regular Medicare, what we call original Medicare policy. The one thing, well, there's a few things, but the one big thing that would have really helped them is planning ahead and fully utilizing their health savings account. They were on a qualifying high deductible health insurance plan for years and years while they were working, and they put a few bucks into the HSA, but you know what they did? They got duped. Some of their friends and coworkers told them about all the things they spent their HSA money on, and they didn't want to miss out. So they spent their HSA dollars, maybe on things that they didn't necessarily need, or maybe they did need them. Whatever the case was, they robbed their future selves of enjoying the tax-free growth in their HSA. Had they instead maxed out their health savings accounts and invested them for growth, then when they were retired, they could take the money out of their HSA to pay for these deductibles, these out-of-pocket costs. They could even use it to pay for some of their Medicare premiums once they turned 65. And by the way, every dollar they pulled out of their HSA would have been taxed at zero. It's tax-free income. Qualifying health savings accounts distributions are not taxable as income. This has a reciprocal effect outside of just the magnificent income tax savings, because now their premiums under Affordable Care Act, Obamacare, and under Medicare are reduced, assuming a big chunk of the cash flow that they are pulling from in retirement is from a health savings account, is from their HSA. All too often, people have a too narrow-minded view of the HSA. They're so focused on the short term, this year, maybe next year. I want to encourage you to think of your HSA as a retirement planning vehicle to help maximize the dollars that you've worked so hard to save and accumulate and enjoy the tax-free growth that can be yours if you instead think of your HSA alongside your IRA, right there with your 401k as long-term retirement planning money. My name is Rizek. I'm a financial advisor CPA, and certified financial planner. If you enjoyed this, you're going to love my new book, Finance on the Fly: Simple Strategies to Build Lasting Wealth. You'll learn real life, applicable strategies in plain English to help you keep more of what you've worked so hard to create. Please don't let all the noise and distractions that are out there rob you of reaching your goals.